Hello, I'm a spokesperson for the PAVE program at the Reno VA. PAVE stands for Preventing Amputations in Veterans Everywhere. It is a VA system-wide program that has reduced the number of yearly major amputations to half of what they were averaging at the program's inception just prior to the year 2000. The PAVE committee is responsible for submitting a yearly report to the central office and implementing action plans for improving the program or correcting deficiencies as they relate to the PAVE directive. As you can see, this page from the audit of our 2013 PAVE report, which was conducted by the Office of the Inspector General, has determined that this station is below the national average for PACT documentation of foot care referrals for patients with foot risk scores of 2 and 3. This documentation deficiency for patients with a foot risk score of 2 or 3 can be easily addressed by using the PAVE Foot Risk and Intervention Clinical Reminder. The purpose of this presentation is to review the effective use of the PAVE Foot Risk and Intervention Clinical Reminder with our PACT teams. This ensures that the important preventative actions performed by our PACT teams is effectively recorded into the patient's CPRS progress note. Before we review the specifics of the PAVE Foot Risk and Intervention Clinical Reminder, let's review the factors behind the assignment of the PAVE Foot Risk Score. This matrix helps assign a risk score to your patient, determined by the number of high-risk diagnoses that apply to that patient. The first column contains the various risk scores. A 0 risk score has a qualifying diagnosis such as diabetes with no other diagnosis contributing to amputation risk. A low risk score of 1 has the addition of one of these 3 diagnoses. A moderate score of 2 has the addition of 2 of these 3 diagnoses. For a high-risk score of 3, the patient would have all of the identified risk factors for lower extremity amputation. Additionally, a high-risk score of 3 is assigned for any one of the following very high-risk diagnoses: the presence or history of osteomyelitis, lower extremity skin ulcer, or a major or minor lower extremity amputation, a history of intermittent claudication, rest pain, gangrene, peripheral bypass surgery, or angiography. And the final singular additional diagnosis for a high-risk score of 3 is end-stage renal disease. With the preceding information in mind, let's take a look at the PAVE Foot Risk and Intervention Clinical Reminder that is in CPRS. As you know, the reminder window is found just above the encounter window when the progress note is activated. Click this to open the options for your clinical reminders. From the previous information given, you would expect a patient with a foot risk score to have a clinical reminder entitled PAVE Foot Risk and Intervention. If your patient should have the reminder, but it is not present in the Reminders Due area, it can probably be found further down the list under the applicable reminders area. Click on the PAVE Foot Risk and Intervention Clinical Reminder to open the window. Patients with a foot risk score of 2 or 3 should have a reminder template that looks like this. The foot risk score is named and described at the top of the template. Immediately below this is a list of interventions available for foot risk scores 2 and 3. One of these needs to be documented in your PACT consult or progress note. Clicking on the one that most closely applies to your patient will assure that action is documented in your PACT clinical note. This is also an excellent way to document foot care education and any other interventions performed at the visit. When you have completely filled out this reminder, click the Finish button and the appropriate data will be recorded in your patient's PACT chart note. Performing these steps in the PAVE Foot Risk and Intervention Reminder will assure proper PACT documentation into CPRS. If you would like to review this presentation or see a transcript It can be found on this station's public drive under My Computer. Finally, on behalf of veterans everywhere, thank you for your participation in this important amputation prevention project.